It's gonna be the questions if you ask me.
Yes. Pretty good. Okay. So just do like a little quick introduction of yourself. Just.
My name's Yvette Mendoza, and I just recently lost my mother to COPD, lung cancer. So I'm pretty fresh right now. So bear with me.
Okay. How long was she diagnosed with COPD?
20 years. She was 62 years old when she was diagnosed. She was a heavy smoker, so she smoked for 35 years. Well, she stopped smoking the day she found out she was diagnosed with COPD. She pretty much lived a pretty normal life for the first like 17 years of being diagnosed. Towards the end, you could see where her personality was changing. She was depressed because it took a toll out of her. She got tired really quick, and it wasn't like her. She was a very strong, independent woman, and when she wasn't able to do things on her own, it really took a toll on her, and she got depressed. The last few years, she had to depend on her daughters, on us. So instead of her being the mom and taking care of us, we changed roles and we took care of her, which was really difficult for her because she wasn't used to that. But we did grow stronger towards the end because she knew how much we loved her and we would do anything for her.
COPD, it is an acronym for chronic obstructive pulmonary disease. And it's a disease process that is made up of two types of diseases clumped into one. So bronchitis or emphysema. And then occasionally there is a genetic disease that you can inherit called the antitrypsin 1 that gets compiled with the COPD diagnosis. So there's actually 4 stages of COPD. They are determined by testing. So it can get very severe to the point where you feel like there's an elephant sitting on your chest at all times, and to the point where you would maybe considering a lung transplant. It's actually pretty common, but it is grouped into elements that are external environmental things. So it's something that you cause yourself. Other than that genetic version of the antitrypsin, which is a protein that gets built up, and that is 1 in every 3,500 of European descent. So if you have a European descent, 1 in every 3,500 can either end up with the antitrypsin or is a carrier. But if you are non-European descent, then you have no risk for it. So the first stage is kind of like a mild stage, and it is determined by an FV1 or a spirometry test, and that stands, the FV1 is a forced vital capacity that measures how much air you can blow out within 1 second. And that is determined by your height, weight, and age. And so the first stage is anything less than 80% of predicted. And then the second stage would be where your FV1 is between 79 and 50%. And then the third is between 49 and 30%, and then the final stage is less than 30% of your predicted volume that you're able to blow out within 1 second at a time.
It's more of the last few years which really affected her. That's when she wasn't able to walk long distances. She got tired really quick, short of breath. And that's when she fell into depression, having to use an oxygen tank, having people help her with her everyday life.
Symptoms are usually It depends on where you lie as to, like, somebody who is categorized with COPD because they have like chronic bronchitis. It's going to be more of a inflammatory response, and it's going to be where you have the soft tissue in your lungs get inflamed, and you produce a lot of mucus. For the emphysema part, it's going to be also the inflammation of the lungs, but it's, for instance, emphysema, you end up with like what they call air trapping. So you have these little itty bitty sacs at the end of your bronchioles in your lungs. And have you ever tried like a water balloon?
Yeah.
And how hard it is to blow it up?
Yeah.
Okay, so, and then when you blow it up, it doesn't really go back to its form, right? So that's kind of how it develops for emphysema. So the lungs don't always get rid of the air, so then the sacs get overextended and the elasticity of them become loose and weak, and so the air gets trapped in there and you're not able to get it out.
We had to closely watch her diet, watch her salt intake. If she has too much sodium in her lungs, will retain water and could elevate her blood pressure and give her shortness of breath. Physical, long distance walking, she couldn't climb stairs anymore. Yes, hot weather, humidity. She had to make sure she was hydrated.
Anything respiratory related, so it'll affect your heart and your lungs, and it will also actually affect your brain. Because if you have too much CO2 in the body and you can't get rid of it, then you start to become lethargic, and you can go unresponsive. A lot of different components, because you have like little alveoli sacs at the end that they lose their elasticity. So if you think about it, if you have a pair of elastic pants and you stretch them out, do they ever go back? No. What do you have to do to fix that? Right, that's exactly right. So, and then they have some treatments. They have these one-way valves that they can put inside the lungs to help eliminate some of the air trapping, so that the air is forced just to go one direction instead of going both ways. So they have that for treatment. They have like, they'll do sleep studies. So if they wear their CPAP or BiPAP machines, which is just it's positive pressure ventilation. So it's a mask that goes over the face or the nose, and it just pushes air in, and it actually, you work against CPAP is just a constant pressure that helps keep those sacs open so the gas can exchange. BiPAP is where you're working against two pressures, so you're breathing against a pressure, and you're and it's also keeping those sacs open so that the gas can exchange, because that's the most important thing, is to make sure that your body can eliminate the CO2 and also get oxygen in, because oxygen is, you know, needed for all of our organs plus our brain.
Yeah.
COPD is monitored and tested by a spirometry that they do, like the forced vital capacity. It is also because it has other factors that it can cause. It can cause heart problems, and it also causes respiratory problems as well. So they can do arterial blood gas sampling, and what that is it gives you a range of numbers, like it determines like the acidity and the alkaline of the body. A lot of people who have COPD build up the CO2 in the body, so the carbon dioxide, and over time your body actually adjusts to it. So a normal CO2 for a person of us would be between 35 and 45. A COPD person, especially in the beginning, we call them like in a 50-50 club, because they're going to be like, their oxygen levels are between 90 to 100 on room air, but it's going to be more like around 50. Their CO2 is going to be more around 50, and then that's going to give you a normal pH, to be quite honest. But you can tell how chronic they are is how much CO2 in the blood that they start to retain with a normal pH.
Basic patience, educating yourself about COPD, help to understand and recognize the signs and changes of the persons you're caring for. If they're smoking, try to get them to quit smoking. Watch their diet, watch their sodium intake, get them to exercise as much as they can.
I would recommend doing like all the studies. There are different studies and treatments because to help with COPD, learn about your smoking cessation programs and the different resources that they have to help people with stop smoking. Like if you're using chemicals, even like housekeepers, when you're dusting and everything, if you really think about that, that stuff is getting in and it's getting trapped into your lungs. So to like wear a mask when you're working with any kind of chemicals or like dust or even outside doing yard work. And that just overall just protects your lungs so that you can have like a longer, healthier lung life. Otherwise, for maintenance, you're going to end up with prednisone, and it just varies. But if you think about any pill that you take or medication that you take, always has a domino effect with it. So with steroids, it causes you to have really paper thin skin, and it can cause like hair loss, and you just become like a little more susceptible to like getting diseases and stuff like a common cold, because it does kind of like weaken some part of the immune system. But the object of a steroid is to help smooth out those muscles so that they relax and then they are able to have gas exchange with it. Bronchodilators are your like you would see with people who have asthma, your puffers and your inhalers, and they have different ones that they have with research that they have developed, but your number one always rescue one is albuterol. So and then what that does is it helps smooth out some of the muscle, but it opens up the airway so that way you can breathe and take that deep breath.
So it's important to help them avoid flare-ups. If they're smoking, help them to stop smoking. Exercising, nothing strenuous, chair exercises, breathing exercises, watching sodium intake, watching their diet, what they eat. Trying to avoid contact with people who are sick, like with flu or upper respiratory sickness. Basically, get to know your person. Are they weak, fatigued? Are they losing their appetite? Is their skin tone changing? Do they get shortness of breath more often? So when you take them to their doctor appointments, you can keep the doctors up to date in their condition.
There is no cure, and actually I don't foresee a cure being for COPD, just because of the damage that it does to the lungs. If you think about it, lungs is a very large muscle, and but other than that, the only other cure, or not even cure, but it's a lung transplant.
Okay.
I don't think that there's enough time and energy that is spent on research for COPD, other than the research that's due to help improve lung life, so that you have the treatment between the bronchodilators, the steroids, antibiotics for whatever infection that may occur. But other than that, there is like not a lot of research that's being done to actually develop or even seek out a cure, because I don't think it's one of those things that's actually going to be a cure. And if something does happen, it's going to be way beyond your grandkids' lifetime.
Yeah, thank you so much for your time.
You're welcome.
Thank you.